Dr. Scott, I've noticed a handful of patients coming into the office who have been committed by other chiropractors out in the community to treatment plans that promise to fix their problem, and yet they are coming back into another chiropractor's office with their same darn issues, and so they're pretty skeptical about moving forward with another plan or another major commitment. How do you handle those?
Well, I think first of all, I think the patient and the decision makers that are there really need to understand the difference in what we do. So that office tour is so critical, and so many of the steps that happen in day one and day two that are leading up to that. But if you're there with a spouse now for the first time, you got to make sure that they've seen the office and what we do is different. I think they need to understand really the difference between just manipulating bones and rehabbing soft tissue, and the process of that, and then understanding those tissue healing principles and how long it takes for ligaments and discs to heal, and really managing their expectations. I think where a lot of chiropractors fail is they just fail to manage expectations. They probably overpromise and then underdeliver, and so a lot of them unfortunately kind of fall flat on their face because of that. You know, one of the questions, once I've established that with a patient, one of the questions I like to ask a patient is just simply, based upon the treatment plan that I've presented and understanding soft tissue healing and understanding all that, first of all, do you feel that this is a program that would address your condition and solve the problems that you're having? If they say yes, we can move forward. If they say no, we've got to do a little bit more education there before we can move forward. And that's really, really important. I think another very, very important aspect is that they understand the examination process, because there are no guarantees. We can't guarantee how a patient's going to put forth the effort to do their home care. I mean, there's a lot of variables that we have to deal with. And so the re-exam process, I kind of go back to that and assure them this may be a 90-day plan or a 4-month plan or whatever the plan is that we're going to do, but we've established stops, and there are control stops there to really check in a re-examination, go back through all of our functional testing, and is function truly improving, and can we quantify that, graph that, and show that patient exactly how much improvement they've made. And in that process, go back and compare. How frequently have you been here? How much effort are you putting forth? What are your pain levels doing? And be able to sit down with that patient and say, you know what? You're exactly where I expect you to be. You're behind. You're ahead. You're doing great. And being able to assure that patient before they get to the end of their plan, they're going to already know that they're progressing. And if they're not progressing, then we need to stop and figure out why. Do we need to get more information? Do we need to refer out and get a second opinion? Do we need an MRI or whatever that may be? We're going to proceed based upon what the exams tell us. So that kind of gives them the assurance that they're going to get their value, or they're going to know prior to the end of their plan.